Hello everyone, in the current session let us discuss about the coding guidelines of chapter 14, that is diseases of genitourinary system. In especially chapter 14, only one topic is covered, that is chronic kidney disease. And let us discuss in detail about the guidelines of chronic kidney disease coding. So first of all, what is chronic kidney disease? CKD is a multi-system disease due to progressive loss of kidney function. Kidney function is generally measured by glomerular filtration rate (GFR) with lower numerical values representing more severe CKD. Lesser the values of filtration rate, more severe is the chronic kidney disease. So in the chronic kidney disease, we will discuss about the following topics: the stages of CKD, chronic kidney disease and kidney transplant status, and chronic kidney disease with other condition. There are specific guidelines to discuss these topics. Now let us discuss about the various stages of CKD. CKD or chronic kidney disease is categorized into 6 stages. Stage 1, Stage 2, Stage 3. Stage 3 is further classified into Stage 3B and Stage 3A and Stage 3B. Then Stage 4, Stage 5, Stage 6 and unspecified stage. Stage 6 is also called as end stage renal disease, ESRD, end stage renal disease. This is the final stage of CKD. Hence the name end stage renal disease. Now coming to the severity of CKD. Stage 2 is considered as mild CKD, whereas Stage 3 is considered as moderate CKD, and Stage 4 is considered as severe CKD. Greater than Stage 4, the CKD is considered as severe, and usually end-stage renal disease requires dialysis. Stage 5 and Stage 6 may require renal dialysis. Now, based on the glomerular filtration rate, let us discuss about the GFR rate of various stages. Stage 1, the usual GFR rate is greater than 90 in case of Stage 1 CKD. For Stage 2 CKD, the range is 60 to 80. Glomerular filtration rate will be in the range of 60 to 80 for Stage 2. For Stage 3, as we have discussed earlier, it is further subcategorized into Stage 3A and 3B. The glomerular filtration rate for 3A is 45 to 59 and for 3B it is 30 to 44. So overall Stage 3, it depends on 30 to 59. If the glomerular rate is between 30 to 59, then it comes under Stage 3. For Stage 4, the GFR is 15 to 20 and for Stage 5, it is less than 15. The glomerular filtration rate is less than 15, then it is considered as Stage 5. Now coming to the various codes. For Stage 1, the code is N18.1. For Stage 2 CKD is described by the code N18.2. Stage 3 is, as we know, subcategorized. Stage 3B is given by the code N18.31. Stage 3A is given by N18.31 and Stage 3B is given by N18.32. Stage 4 is given by N18.4 and Stage 5 is given by N18.5 and end stage renal disease or Stage 6 is given by N18.6 and unspecified stage is given by N18.9. Whenever the physician simply documents CKD, we have to code N18.9. When the physician documents CKD Stage 2, CKD Stage 2, then you have to code N18.2. If he documents CKD Stage 5, you have to code N18.5. If you document CKD Stage 3B, you have to document N18.32. Now let us discuss some examples. First example is stage 5 chronic kidney disease with end stage renal disease requiring chronic dialysis. Here, the patient is a stage 5 chronic kidney disease patient with the ESRD. So, ESRD and stage 5 both are given. Then the code is N18.6. Whenever end-stage renal disease is documented by any other stage, you have to consider only end-stage renal disease. So here the answer is N18.6 followed by Z99.2 because he is requiring chronic dialysis. Z99.2 is the hemodialysis status. In this case, there is one more note. Usually when you find N18.5 in tabular list, you will find an excludes note, excludes one note under N18.5 code. That is excludes one chronic kidney disease stage 5 requiring chronic renal dialysis. This indicates that whenever the physician documents chronic kidney disease stage 5 requiring chronic dialysis, then you should quote N18.6, not N18.5. You can find this in the tabular list. Coming to second example, hypertensive patient with history of CKD stage 2 undergoing dialysis for ESRD. Here, the first code is I12.0. Hypertensive chronic kidney disease with stage 5 or end stage renal disease followed by N18.6 and then Z99.2 hemodialysis status because the patient is undergoing dialysis. If both the stage of CKD and ESRD are documented, assign only ESRD. That is nothing but N18.6. Now coming to chronic kidney disease with kidney transplant status. This is also a tricky topic. Patients who have undergone kidney transplant may still have some form of CKD because the kidney transplant may not fully restore the kidney function. This is important. The patients who have undergone kidney transplant may still have some form of chronic kidney disease because the kidney transplant may not fully restore the kidney function, and the presence of CKD alone does not constitute a transplant complication. We have separate codes for transplant complications that we will discuss in detail when we talk about that topic. Here, the presence of CKD alone does not constitute a transplant complication. Assign the appropriate N18 code for the patient's stage of CKD and code Z94.6. That is nothing but kidney transplant status. Let us see one example for better understanding. Patient with residual chronic kidney disease stage 1 after kidney transplant. Here, patient has undergone kidney transplant. But as we have discussed earlier, patients who have undergone kidney transplant may still have some form of CKD. Here, we have to consider that even though the patient has gone transplantation, still some form of CKD will be present. So the codes are N18.1 stage 1 CKD followed by Z94.0 kidney transplant status. Here you should not consider the CKD as transplant complication. If transplant complications such as failure or rejection or other transplant complication is documented, then we have to code in a different scenario. We will discuss this when we talk about that topic. So if the documentation is unclear as to whether the patient has a complication of transplant, we must query the provider. Unless and until other transplant complications such as failure or rejection or other transplant complications which compromise the function of the kidney, CKD alone should not be considered as a transplant complication for kidney transplant patient. Patients who have undergone kidney transplant may still have some form of CKD because the kidney transplant may not fully restore the kidney function. Apart from CKD, If other complications are there, such as failure, rejection, etc., then you have to quote T86.1. That is transplant complication of kidney. Code T86.1 should not be assigned for post-kidney transplant patients who have CKD unless a transplant complication such as transplant failure or rejection is documented. If the documentation is unclear as to whether the patient has a complication of transplant, query the provider. The provider must be queried. Conditions that affect the function of the transplanted kidney other than CKD should be assigned a code from category T86.1. Complications of transplanted organ, kidney, and a secondary code that identifies the complication. Let us see an example here. The patient has kidney transplant failure with the chronic kidney disease. Here the transplant failure is a transplant complication. Hence you have to use a T code. T86.12, kidney transplant failure for complications of transplanted kidney, followed by N18.4, that is the stage of CKD. Now next, chronic kidney disease with other conditions. So CKD may be associated with conditions such as diabetes, hypertension, both hypertension and heart failure. So diabetic CKD, it usually requires two codes. First code to indicate the type of diabetes, which comes under the series E08 or 09 or 10, 11 or 13 with 0.22. For example, if type 2 diabetes is type 2 diabetes with CKD, then you have to code E11.22. If type 1, E10.22, like that. Then followed by stage of CKD. So diabetic CKD usually requires two codes, type of diabetes and the stage of CKD. Next, hypertensive CKD. Hypertensive CKD may require two or three codes. Similarly, hypertensive heart and CKD. This also requires three codes. We'll discuss what are the codes. First, coming to hypertensive chronic kidney disease. That is, patient has both hypertension and chronic kidney disease. Hence the term hypertensive chronic kidney disease. And these two are related with convention. Hence they must be considered they are related. Unless the physician documents they are not. Now coming to the codes. For stage 1 to 4 and for unspecified stage of CKD, we assign two codes. I12.9 followed by code for stage of CKD. I12.9 is nothing but hypertensive chronic kidney disease from stage 1 to 4 and unspecified. If CKD stage 5 or ESRD, if the patient has stage 5 or end stage renal disease, here also two or three codes are required. First code is I12.0. Next followed by N18.5 or N18.6. Then if the patient is on renal dialysis, this is the third code, additional third code, then you have to assign Z99.2, hemodialysis status. Hence, if the patient is hypertensive and suffering from stage 5 or stage 6 CKD, you need to assign two or three codes based upon the requirement. If the patient additionally has acute renal failure, then you have to code an additional code N18.9 for acute renal failure. If the patient has CKD, hypertension and acute renal failure, then the codes are from I12 series, code for CKD and additionally code for acute renal failure N17.9. Coming to hypertensive heart and CKD. If the patient has heart related condition and CKD and the patient is hypertensive, In that case, you have to assign a code from I13 series. If the patient has hypertension, heart involvement and kidney involvement, I13.0. Dash indicates the code is further subcategorized. So hypertensive heart and CKD is categorized into two types, with heart failure and without heart failure. With heart failure, for CKD stage 1 to 4 and unspecified. Without heart failure, the codes are I13.0 plus type of heart failure, which comes under the series I50, plus stage of CKD. So three codes are required for hypertensive patient without heart failure with the CKD. I11.0 plus type of heart failure plus type of CKD. If the patient is suffering from end stage or stage 5 CKD, then the codes are I13.2 plus heart failure plus CKD plus Z99.2 to indicate if the patient is on dialysis. So this scenario may require 4 codes. Now coming to patient, hypertensive CKD patient without heart failure. The hypertension code is I13.1. It is further subcategorized. For hypertensive patient who has CKD and does not have heart failure, the codes are I13.10 plus type of CKD. Here heart failure is not there, hence additional heart failure code is not required. Next, if the patient is suffering from CKD stage 5 or end stage renal disease, the code is I13.11 plus type of CKD plus Z99.2 if the patient is on dialysis. So with heart failure and without heart failure codes, hypertensive chronic kidney disease, with heart failure and without heart failure. Now let us discuss some examples. Diabetic patient with hypertensive chronic kidney disease. The codes are E11.22. Because the type of diabetes is not mentioned, you have to consider type 2, E11.22, diabetic CKD plus I12.9, hypertensive chronic kidney disease, NOS. Followed by here, physician has just mentioned chronic kidney disease. He did not mention the stage. Hence, unspecified stage, N18.9, chronic kidney disease, NOS. Coming to second example, patient with chronic kidney disease, stage 2, with heart failure with reduced ejection fraction, with past medical history of hypertension. Here the codes are I13.0, hypertensive heart with heart failure and stage 1 through stage 4 or unspecified stage. Because here the stage of CKD is stage 2, we are assigning I13.0. I13.0 must be assigned from stage 1 to 4 and for even unspecified CKD with the heart failure. Additionally, heart failure code I50.20, heart failure with reduced ejection fraction or systolic heart failure, followed by CKD stage code N18.2. Now coming to next example, patient with ESRD on renal dialysis with the heart failure. The codes are I13.2, hypertensive heart with heart failure with stage 5 chronic kidney disease or end stage renal disease, followed by N18.6, which is nothing but ESRD. And since the patient is on renal dialysis, you have to code an additional code Z99.2, hemodialysis status. Coming to fourth example, hypertensive patient with diastolic heart failure admitted with CKD superimposed with acute renal failure. He is admitted. The reason for admission is CKD superimposed with acute renal failure. So additionally, you have to code acute renal failure N17.9 followed by I13.0. hypertensive heart with heart failure. Since CKD stage is not mentioned, stage 1 through stage 4 CKD or unspecified CKD, N18.9, chronic kidney disease NOS, and finally I50.30, code for diastolic heart failure. Thank you for watching. Please subscribe for further videos on medical coding.